Good evening. The name of this article, a study on the role of a Vamana on a serum bilirubin and a calcium level. This article written by Vijaya Lakshmi Nara. You can download it from the internet also. What are the abstract of this article? Normal pitta maintains a normal hepatic metabolism. Serum bilirubin and the calcium level are associated with the hepatic function. Vamana and Sweda karma increases Agni, which in turn affect the liver metabolism. The raised Agni and Sweda and Vamana increases the metabolic activity of the body. Today's quality of a food and dietary habit lifestyle changes is a seasonal, often the causes of a saturation of toxins in the body, which according to the Ayurveda are a mala and ama, and these are also cause for the vitiation of a dosha. When the body become free from these mala or ama and the vitiated dosha, a state of good health can be achieved. Ayurveda has an best therapist to perform a panchakarma to make a body free from these diseases causing factor. Aim is to study on the role of a vamana on a serum bilirubin and the calcium level, to study the bodily changes after a vamana karma, materials and a method. 40 patient of a tamaka shvasa and a sidma kushta divided into a two group, each consists of a 20 patient. The treated group patient were divided into a 10 each Tamakashwasa and a Siddhma Kushta, managed with the Snehapan, Sveda Karma, finally with the Vamana Karma. Effect of a Snehapan, Sveda, Vamana on a serum bilirubin, calcium were evaluated before treatment and after Sneha Sveda and at the end of the treatment. Result: marginal changes seen in the study. 85% of the symptoms relieved in both the diseases. Conclusion: Vamana can improve the functional and the metabolic activities of the body. The clinical sign and symptoms were decreased after the Vamana karma. Tam Introduction. Tamaka Shwasa and the Siddhma Kushta are selected because of their chronic nature. Vamana is selected for the purification of the vitiated kapha, which is mainly responsible for the pathology in both the disease. This topic is selected as a Vamana expels abnormal kapha dosha and the Vidagda Pitta. Kapha and a rasa have a dosha dhatu ashriya bhava sambandha. Vamana and a Sweda karma increases Agni, which in turn affect the liver metabolism. Normal pitta maintain a normal hepatic metabolism. Serum bilirubin and the calcium level are associated with the hepatic function. The liver is the largest and the most significant metabolic organ of the body. It is the center of a diverse metabolic reaction that occur in the body. The raised Agni after the Sweda and Vamana increases the metabolic activity of the body. Vamana, that is medicated emesis, is the best biopurifactory procedure in the kapha dominant and the vitiated conditions such as the tamakashvasa and the siddhma kushta, as described in Ayurveda. While studying a chikitsa, that is a line of a treatment from the Ayurveda text, it was noticed that shodhana purificatory measure is advised first. Obstruction, that is a sanga pathology, was observed to be the due to the vitiation of a dosha. Kapha has a maximum ability for the obstruction due to its attributes. Today's quality of a food and dietary habits, lifestyle changes in a season are often cause the saturation of a toxin in the body, while according to Ayurveda are malas and ama, and these are also cause of a vitiation of a dosha. Unless and until the body become a free from these mala, ama and the vitiated dosha, a state of good health can't be achieved. Ayurveda has an best therapies in the form of a panchakarma to make a body free from these diseases causing factor. Excellent result can be achieved even in lesser time after the panchakarma. The patient can be treated with the less consumption of a medicine within a short period, so it saves the time as well as expenses of the medicine. Aims and objective to study or to see the effect of a Vamana karma on a serum bilirubin and the calcium values, to throw the light on the bodily changes after the Vamana karma in the rasa component of a rasa rakta complex. 40 patients were selected irrespective of their sex and religion randomly from the OPD. Dr. B.R.K.R. Government Ayurved College, Hyderabad, Andhra Pradesh, India, divided into a treated group and control group, each consisting of 20 patients. The treated group of the patient was divided into a 10 each of a tamakashvasa and a siddhma kushta, that is psoriasis, managed with the snehapan, sveda karma, and finally vamana karma. Lab investigations such as the routine biochemical test were conducted and recorded at the time of the admission. All the investigation was repeated at the end of a sveda karma and also on the fourth day of a Vamana karma in a treated group of a patient. In the control group of a patient, these were repeated at the end of a treatment. All the patients are advised to fast for about 12 hours before the collection of a blood sample. Blood was collected from the cubital vein. Parameter of assessment: administration of a snehapan, that is internal oilation. After the completing all the examination and the investigation, the treated group of a patient were given a snehapan indukanta grutam given in a tamaka shwasa patient. As I mentioned is a sahasra yoga and a mahatiktam grutam said in ashtanga hridaya was given to a sidma kushta patient at 6 am. The digestive power and the throat was noted on the daily basis to assess the state of a kushta of the patient. Sveda karma, that is a sudeshana. Bhashpa Sveda was done. That was processed by the Abhyanga with the Dhanvantari Telam in a Damakashwasa patient and Dhanisheka Keram in a Siddhma Kushtaha patient. It was noted that desired effect of a Sveda karma were seen in all the patients within a 20 minutes. After the completion of a Purva karma, the investigation were carried out. Vamana karma, a day previous to a Vamana karma, that is after 2 days of a Sveda karma, the patient were fed with the masha and a milk for a kapha utklesha. On the day of a Vamana karma, during a kapha kala in the morning, the patient were once again subjected to a local massage with a sneha karma and a svedan karma before giving a Vamana drug. Cow's milk 2 to 3 ml was given to the patient to a drink, followed Sneha karma and Sweda karma before giving a Vamana drug. Cow's milk 2 to 3 ml, ml not liter, was given to the patient to a drink, followed by the uh, actual Vamana drug in a single dose. It contains 10 gram Madanaphala Pimpri Churna, that is Randea dumetorum, 5 gram of Vacha, 10 gram of Sendhava Lavanaha, rock salt. All these were mixed well by a grinding. This paste mixed with 100 ml of milk and was administered. In most of the cases, spontaneous emitting started with a maximum period of 30 minutes. A little quantity of a Sendhav Lavana with a warm water was given as adjuvant to the original Vamana Dranga to induce the vomiting. After Vamana, the patient were given a short course of a Sausarjan Krama in the form of a kanji or a peya for 3 days. During the entire process of treatment, no other medication was given to any patient. On the 4th day, Vamana Karma and the lab investigation were once again recorded. In the control room, the patient were treated with a symptomatic treatment only. In a Tamaka Shwasa patient, Dashmula Katu Trayah Quatham 90 ml, Pteridea sumedum, or 3 times a day TDS, or a Kanaka Asavaha with the Vasa Arishta 30 ml 3 times a day was given for 20 days. In a Siddhma Kushta patient, Patvaladi Quatha 90 ml and Gugula Tikta Grutama 15 gram 2 times a day we are given for the 20 days. Lab investigation were carried out in order to assess the treatment. In this group 2, all the patients were advised to report once in a month for a follow-up studies. After completing all the examination and the investigation, the treated group of the patient were subjected to the course of a snehapan. The result obtained were compared with each other and analyzed statistically. Biochemical and the serological investigation. There will be a marginal change in the serum bilirubin that was observed in the treated group, while the serum bilirubin in the control group remained unchanged. In the treated group before Sneha Sweda, the mean was 0.23 mg per 100 ml. After the Sneha Sweda, it was 0.26 mg per 100 ml. After a Vamana, it was 0.24 gram. In the control group, initially 0.27 and after the treatment 0.27. There was a significant or a marginal increase in a serum calcium in the treated group of a patient. Before the Sneha Sweda 9.53 gram, after Sneha Sweda 9.98, and after the Vamana 9.95 mg. In the control group, the initially means 9.15 and after the treatment 9.03. In a Tamaka Shwasa patient, 85% of the cases improved well with respect to a recurring attack of the paroxysmal dyspnea, wheezing, cough, and a sense of constriction in the chest and the hyperresurrection. 15% of the cases were had a moderate response. In the treated limited group of the patient. Out of 85% of the cases, one patient show a immediate change in the sign and symptom after the Vamana karma. The primary characteristics of the Siddhma Kushta are itching, circumcised eruption, and the reddish brown papules. The beneficial effect of a Vamana therapy are stoppage of a spreading of the lesion but no change in a color, change of a color from the reddish brown to a normal 1 month after the Vamana karma. All the patients were advised to report once in a month for a follow-up. About 80% of the patients cooperated with the follow-up studies. The most interesting phenomenon noted in this period was that the patient who underwent a Vamana therapy for the group of a Siddhma Kushta got a very good response. In the case of a Tamakashwasa, the relapse was very rare. Only 3 patients complained about the relapse. In the case also, the intensity was very much reduced than the previously. Incidence of the age and the sex. Tamakashwasa, Siddhma Kushta, you can see on the screen. Discussion. Systematic Sanshodhan of the body can have been conceived as a prime prerequisite for all the kinds of preventive and the curative procedure. Vaman is one of the most effective treatment for the number of pathological condition, especially kapha predominant diseases. Mode of action of a Vamana karma. The mechanism of action is a complex in nature. The kapha located in the stomach supports all the kind of kaphas of the body by its ambukarana, that is the welfare of the body through the watery component. The different kapha in the body represent a different fluid located in and associated with a different organ of the body by support and the nourishment. These may have understood as a various extracellular fluid component of the body and the transport of essential nutrient including the water in this different fluid compartment for the specific purpose of support and the nutrition of the respective organs associated with the kapha takes place through the reseracha complex, especially a rasa component. Similarly, ambukaran of a kapha is associated with the rasa component of a reseracha complex as explained by Sushruta, who said that it's a kledaka kapha which is located in amashya when eliminated from the organ by the upper root through the process of a Vamana kriya, it being a supporter of all the other kaphas of the body leads to the correction of a violation of a kaphas in the body. Here the elimination of the kapha understood by its apadhatu through the mouth that it will prevent its passage through the small intestine. Therefore a Vamana kriya prevent reabsorption of this factor through the Shudra Shudra that is a small intestine, and therefore ensure a definite elimination of the body by equating a kapha with a micropolysaccharide. While studying effect of the Vamana karma, K.N. Udupa and R.S. Singh having already established that there is an increased elimination of the kapha from the stomach. Since pitta is also located in the amasya during the process of a Vamana kriya, pitta is also eliminated from the amasya through the mouth. While describing the physical quantity of a pitta, Sushruta state that rasa of a pitta is a kattu and vidakta state it is a amla. According to Dallan, the taste is a kattu in a prakrut state of an amla is in a immature state. Therefore, there is a taste of a pitta present in amasya, as in the case of a digestion of a food is not a complete, and the product of such digestion are only ama, that is immature due to a amla avastha, that is to be considered as a amla ras only. It is an undisputed fact that amla ras of a pitta located in the amasya it is due to the HCl component of the gastric juice. Therefore, in a Vamana, the amla ras of pitta along with the HCl is eliminated from the stomach by the upper root. Therefore, it is clear that there is a loss of not only a water but also a chloride radical. Along with the chloride radical, a certain amount of sodium is eliminated. It was observed that serological results were increased after the Sneha Sweda karma. The Sneha Sweda will bring the viated drusha from the various part of the body through the transport vehicle Rasarakta complex to the Koshtaha. Vamana eliminate the causative factor of the somatic diseases and maintain a homeostasis. The dosha we might have lodged in the Koshta Dhatu and Srota made a clean natva by administration of a sneha. The clean mala are liquefied by the use of a Sweda karma in the presence of Agni. The Agni increases the metabolic activity of the body. Sneha Sweda showed the improvement. Mode of action on a serum bilirubin. It was observed that serum bilirubin was increased slightly as the value is related to the liver function. Liver is the largest and the most significant metabolic organ of the body. It is the center of the diverse metabolic reaction reaction that occur in the body. So after Vamana, the metabolic process of the body may be the enhanced mode of action on a serum calcium. Sneha Sweda Vamana increases Agni, maintain harmful hepatic metabolism and facilitate a normal calcium absorption from the body by producing a normal Asti Majja Dhatu helps the keep calcium level normal in the body. The clinical improvement were agreed by the lab investigation. The patient were reported a good relief during the follow-up studies. Most of the sign and symptom were disappeared within a short time after the Vamana Karma. No inspiring result were obtained from the control group of the patient. Conclusion: it was provided that 5 to 7 days were taken to produce the optimum Snehapan effect. It was noticed that Sneha Sweda Karma were highly essential prior to a Vamana. Vamana can improve the functional and the metabolic activity of the body. The clinical signs and symptoms of a Siddhma Kushta patient were decreased after a Vamana Karma. In a Tamaka Shwasa, Vaman eliminate whited kapha and subside the congestion of the chest. It will minimize the relapse and also intensity of a Tamaka Shwasa. All the serological results were within the normal limits in a both treated group and a control group of the patient. The therapy not only produces a symptomatic relief but also control the disease process. It maintains the health of the individual and help in the promotion, preservation and the longevity of the life. The present trial is the only preliminary study on the subject. Even though some changes have been found in the blood chemistry, it is suggested that further studies can be conducted on the eligible alignments of the Vamana where abnormal blood chemistry can be noticed due to the pathological condition of the respective disease. Financial support and sponsorship remain conflict and interest. There are no conflict of interest. Sanhita, Ayurveda Deepika Commentary, Chakrapani Datta Sutra Varanasi. All these are the references. You can download it from the internet. In this way, there is a Vamana study of study on the role of a Vamana on a serum bilirubin and the calcium level. Thank you so much for listening me this original article of a Vamana.